So the preparation for surgery is, a big part of it is mental, and that's the education part of it. We do have patients go to a prehabilitation program.
They have a program that's set up to take you literally from the day you have surgery through the point where they release you. It was a phenomenal process. They did an incredible job.
It's important that these patients be in the best shape possible so that they can go through the rehabilitation, so it doesn't knock the stuffings out of them as badly, and so they can recover faster.
It was probably the easiest, simplest, straightforward process of all the surgeries that I ever had.
We're always trying to make it a simple process. We're always trying to make it as pain-free as possible. But one of the things I will always tell patients is that if you're not having pain, we're not pushing you hard enough.
For me, there was not one simple event that happened and all of a sudden I went from not having pain to having pain. It's been something that's built up since I was in 8th grade. So I didn't realize how much pain I was dealing with until after I had the surgery. The level of pain that I experienced was less than what I was dealing with before. So my quality of life is literally night and day.
We're going to, especially early on, make sure that you get your range of motion, and it's going to hurt. And we try to make sure that they have a very realistic expectation of and understanding for the whole process.
For me, the pain became, if you will, unmanageable within the last couple of years. I had an arthroscopic procedure done about 5 or 6 years ago. At that point, they noted that I was bone on bone.
Some patients are incapacitated. They've been in a wheelchair for a year, can't get around at all, and they finally decided it's time for a knee replacement. Other patients will come in and say that, I used to be able to walk 18 holes, now I have to ride a cart.
And I knew that anytime I went out, if I walked for a long period of time, I also umpire. Anytime if I went and I did a baseball game or a football game, that my knee, there was more pain to it. It felt like it was on fire when I was done.
And so people come in with all kinds of reasons that they would like a joint replacement. We feel that our job is to really have a sincere discussion with these people and make sure they understand the expectations.
The only expectation I had was to walk out of this pain-free, or as relatively pain-free as possible.
Patients are very happy with their range of motion, so they're functioning well. We're not seeing the problem of stiffness.
My family's reaction has been very positive overall. They were apprehensive. They thought that there was going to be a lot of pain. They thought that there was going to be a very long recovery period. When it was all said and done, though, they realized that it really wasn't.
The satisfaction rate is very, very high. And again, I think that's related to not just the prosthesis, not just the anesthesia, not just one factor or another. It's really related to navigating the whole process.
To them, it was phenomenal. They didn't really see any kind of a change, but it was a positive effect.